My name's Ian. I'm a farmer. I live in Yankalilla in South Australia. I've been coming to the centre here for about 12 years now. I first met Chris when I came here, and we just seem to have a rapport. I understand him, he understands me, and he, I guess, is one of those people that you find that really digs to come up with an answer. He's just like some of the bloody good mechanics we had on the Air Force. Record keeping has been in the aviation industry ever since it was invented. Every aeroplane that's ever built has its own maintenance log with it, and it's the perfect system. When Chris told me about my health record, he didn't have to sell me at all. My health record gives you the facility to go in and immediately investigate what your maintenance record's been like as a human being.
Well, there's so many benefits for patients in terms of getting information to the point of care when there might be no other information. For example, patients who are travelling, patients who turn up in hospitals or emergency departments. This really is a document which can represent the patient in terms of their wishes, but also tell us who we need to talk to if a patient has lost the capacity to make decisions. Ian's case was an excellent example of where the My Health record could come into its own.
It was my son's birthday. As usual, we went to Sydney for this particular son's birthday, checked into the hotel. 3 hours later, I was in the back of an ambulance heading to St Vincent's Hospital, and they found I had a thing called a pancreatitis. Eventually, after 4 days in there, I talked them into letting me out on the basis that as soon as I got home, I went to see my own doctor.
He had been discharged from a hospital from another state with no information. He'd been told that he needed to follow up and to get something important done, and he presented to me with no information.
With the My Health record, of course, it was available within, a minute of walking into Chris's room.
I was able to look at the My Health record and found that there was a discharge summary with information about what he'd had and what he needed done. And that was gold in this situation. It was information that I would not have otherwise had, and which made all the difference to his care at that stage.
He knew exactly what to do to pick it up from that point and to start caring for me on the basis of what he'd found in the My Health record.
There's potential now to add things like pathology and diagnostic imaging, that's blood tests and x-rays, tuned to the point of care when we've never had that before.
Marvellous system. I'm glad I signed up for it 2 or 3 years before. It looks after me, and that's what it's for.